Welcome to the e-learning module on the safe prescribing and administration of controlled drugs and substances for Ontario midwives. Before we begin, let's go over what this module will cover and how it is structured. This is a self-paced video. You can proceed through the content at your own pace, ensuring you have time to absorb and reflect on the information provided. Please click the pause button at any time if you need time to reflect on the material or take notes. The module is split into concise sections. Each section addresses key areas of legislation, standards, and professional responsibilities. Please note there are no quizzes or assessments in this course. This module is designed for informational purposes only, aiming to inform and update you on critical legislative changes and best practices. The designated drugs regulation has been expanded to improve client care through more direct access to necessary drugs and substances. In 2024, a new designated drugs and substances regulation came into effect, setting out a list of drugs midwives can prescribe and substances that midwives can administer by injection or inhalation on a midwife's own authority within the scope of midwifery practice. The new regulation adds additional drugs and substances to the list that midwives may prescribe and/or administer on their own authority. Access to these new drugs and substances will reduce the need for midwifery clients to seek care outside midwifery for treatment that is within the midwifery scope of practice, improving the quality and timeliness of care for clients. The changes to the list include hormonal contraceptives, expanded analgesia, additional antibiotics, updates to the vaccines that a midwife can administer to include many routine vaccines clients receive during pregnancy, and other additions to align with current best practices. Upon entry to the profession, midwives must possess the necessary knowledge, skills, and judgment to safely prescribe drugs and administer substances within the midwifery scope of practice. Midwives must maintain or acquire the necessary competencies throughout their careers to safely prescribe and administer new drugs and substances, especially as medication treatments change. This module does not provide clinical training and only discusses the requirements that must be met to prescribe and administer the controlled drugs and substances listed on this slide. For general information about the other drugs and substances, please visit our website at www.cmo.on.ca and access the new regulation. Completion of this online module satisfies the requirements set out in Sections 1, Subsection 3b, and Section 4, Subsection 2b of the Designated Drugs and Substances Regulation for Ontario midwives to prescribe and administer in public hospitals on their own authority the following controlled drugs and substances listed on the slide. This module will help you, number one, understand the legislative and regulatory framework to independently prescribe and administer controlled drugs and substances in Ontario. Number two, be familiar and comply with the standards set out in the College of Midwives of Ontario Professional Standards for Midwives, the Prescribing and Administering Standard, and the Record Keeping Standard with a focus on prescribing and administering controlled drugs and substances. Number three, increase awareness of the opioid crisis in Canada and understand the role midwives play in mitigating opioid-related harms. Section 1. Legislation and Regulation Overview. This section provides an overview of the legislative and regulatory framework concerning the use of controlled drugs and substances within the midwifery scope of practice. It references the Controlled Drugs and Substances Act, the Regulated Health Professions Act, the Midwifery Act, and the Designated Drugs and Substances Regulation. Section 1.1, Controlled Drugs and Substances Act. The Controlled Drugs and Substances Act, known as CDSA, is the federal law that regulates the possession, production, distribution, and sale of drugs and other substances that are considered to be controlled or illegal. A controlled substance is any type of drug that the federal government has categorized as having a higher than average potential for abuse or addiction. Such drugs are divided into categories based on their potential for abuse or addiction. Controlled substances range from illegal street drugs to prescription medications. The primary goal of a CDSA is to protect public health and safety by controlling access to drugs and substances that can pose a serious risk of harm to public health or safety. The CDSA permits registered midwives to prescribe and administer controlled drugs and substances if specified under the laws of the province in which they are registered and entitled to practice. The practice of healthcare, including the regulation of healthcare professionals, falls under provincial jurisdiction in Canada. Midwives in Ontario must adhere to the provincial regulations and professional standards related to the prescription and administration of medications, including controlled drugs and substances. Section 1.2, the Regulated Health Professions Act and the Midwifery Act. The Regulated Health Professions Act, also known as the RHPA, is the umbrella legislation that governs 30 health professions in Ontario, including physicians, nurses, and midwives. This provincial law limits the performance of 14 controlled acts, which are the procedures, tests, and treatments considered to pose a risk of harm when performed by someone who is not qualified to perform them. Because there is a risk of harm in performing controlled acts, they can only be performed by the regulated health professionals who are authorized to do so by their profession-specific acts, for example, the Midwifery Act. In addition, some controlled acts may be performed by individuals by way of exemption, detailed in either the RHPA or in the Controlled Acts regulation made under the RHPA. As set out in the Midwifery Act, midwives are authorized to perform 11 controlled acts. All of the controlled acts authorized to midwives are authorized only partially, which means midwives do not have the authority to perform any of the controlled acts in their entirety without limitation. Midwives are authorized to perform the controlled acts of prescribing drugs and administering substances by injection or inhalation. However, these controlled acts are limited as midwives are only authorized to prescribe or administer the drugs and substances specified in the designated drugs and substances regulation. Midwives may not perform the controlled acts of dispensing, selling, or compounding a drug unless these controlled acts are delegated to them by a health professional who has the authority to do so. Please consider the following definitions of key terms that are used in the legislation and regulation. Delegation. Delegation means a process where a regulated health professional, the delegator, who is authorized to perform a controlled act, as defined under the Regulated Health Professions Act, designates that authority to someone else, the delegatee, who is not authorized to perform that controlled act. When an act is delegated, both the delegator and the delegatee are accountable. Delegation is carried out by either a direct order or a medical directive. Prescribing. Prescribing a medication includes giving written instructions for dispensing a medication by a pharmacist and self-administration of that medication by a client. As well, the act of prescribing can include prescribing for the purpose of administering a medication. Drugs that may be prescribed by a midwife fall under Schedule 1 and Schedule 4 of the regulation. In addition, midwives may prescribe any drug that may lawfully be purchased or acquired without a prescription, as set out in Section 6 of the regulation. Administering. Administering medication is giving a medication through the correct route to a client. Midwives can administer any medication that they are authorized to prescribe. The regulation specifies which drugs can be administered by inhalation and which drugs can be administered by injection, as these procedures are controlled acts authorized to midwives. Drugs that may be administered by inhalation by a midwife fall under Schedule 2 of the regulation. Drugs that may be administered by injection by a midwife fall under Schedule 3 and Schedule 4 of the regulation. Administration of medication by means other than injection or inhalation, such as oral or topical, is not considered a controlled act and may be performed by midwives. Administration of medication per vagina or rectum is authorized to midwives pursuant to paragraphs 7 and 8 of Section 4 of the Midwifery Act. In addition, midwives may administer any substance that may lawfully be purchased or acquired without a prescription, as set out in Section 6 of the regulation. Ordering. Ordering a medication is the way that midwives prescribe a medication to be administered by a nurse in the hospital. This can be a verbal or written order, or may be part of a set of medications that midwives order based on hospital protocols. In addition, midwives can receive orders from physicians or nurse practitioners to administer medications by inhalation or injection that are not included in the regulation as set out in Section 5, subsection 2 of the regulation and 4.1, subsection 2 of the Midwifery Act. In addition, midwives may order any drug or substance that may lawfully be purchased or acquired without a prescription, as set out in Section 6 of the regulation. Using. Using a medication means administration of a medication by any means other than inhalation or injection. This includes oral, vaginal, topical, or rectal routes of administration. Midwives can administer any medication that they are authorized to prescribe. In addition, midwives can receive orders from physicians and nurse practitioners to use medications that are not included in the regulation, as set out in Section 5, subsection 1 of the regulation. Dispensing. Dispensing is a transaction that occurs after receiving a prescription and providing that medication pursuant to a prescription and involves record-keeping obligations on the part of the dispenser and a resulting label on the drug with identification markings. Dispensing also means giving one or more doses to a client to take at a later time, but it does not include the distribution of drug samples. Dispensing a medication is a controlled act that is not authorized to midwives. Midwives must receive a delegation to dispense a medication. Section 1.3, the Designated Drugs and Substances Regulation. The Designated Drugs and Substances Regulation, under the Midwifery Act, is the provincial regulation that sets the limits and conditions for midwives to prescribe and administer specific drugs and substances. In 2024, a new Designated Drugs and Substances Regulation came into force, which expanded the list of drugs and substances a midwife may prescribe or administer while practicing the profession. Ontario midwives can now prescribe and administer on their own authority and only in public hospitals the controlled drugs and substances set out in Schedule 4 of the regulation. as long as the midwife complies with the requirements set out in sections 1, subsection 3A or B, and section 4, subsection 2A or B of the Designated Drugs and Substances Regulation. Section 1.3.1. Sections 1, subsection 3A and B, and section 4, subsection 2A and B of the Designated Drugs and Substances Regulation. Section 1, subsection 3A and B of the regulation describes the requirements that must be met before prescribing for the purpose of administering the controlled drugs set out in Schedule 4. Section 4, subsection 2A and B of the regulation describes the requirements that must be met before administering by injection the controlled substances set out in Schedule 4. The controlled drugs and substances listed in Schedule 4 of the regulation are fentanyl citrate, meperidine, morphine sulfate, and nalbuphine. The requirements that must be met before prescribing or administering these controlled drugs and substances are as follows. The midwife must first have either A. Satisfied the registrar or the registration committee that the midwife has sufficient knowledge, skill, and judgment based on the midwife's formal education and training to safely and competently prescribe drugs and administer by injection substances set out in Schedule 4. Or B. Successfully completed a course approved by the Council on Prescribing Drugs and Administering by Injection substances set out in Schedule 4. By completing this course, you will be satisfying the requirements set out in Sections 1, subsection 3B, and Section 4, subsection 2B of the regulation. Section 1.4, links. For more information on the legislative and regulatory frameworks referenced in this section of this online module, please visit the following resources. The links to all resources are available on our website. Section 2, Standards of Practice. This section focuses on the standards of practice relevant to the safe prescribing and administration of controlled drugs and substances. The standards provide the minimum expectations that must be met by midwives. It is expected that all midwives review these standards in their entirety to understand their relevance to prescribing and administering drugs and substances, including controlled drugs and substances designated in the regulation. To guide this review, this section will highlight specific examples of standards and demonstrate how they may be applied within the context of prescribing and administering controlled drugs and substances. However, these examples serve merely as a starting point. It is expected that midwives will refer to the professional standards for midwives and the complete set of additional standards available on the college website for a comprehensive understanding. Section 2.1, Professional Standards for Midwives. The professional standards describes the minimum requirements regarding one's practice and conduct and helps midwives achieve the best outcomes for their clients and the public. 5 mandatory principles form the professional standards. These principles include professional knowledge and practice, person-centered care, leadership and collaboration, integrity, and commitment to self-regulation. Midwives must be able to demonstrate at all times that they work in accordance with the principles and standards set out in the professional standards, which includes when prescribing and administering the controlled drugs and substances listed on this slide. To help understand how the standard applies to the prescribing and administering of the 4 controlled drugs and substances, the following examples are provided. These are intended to be illustrative and are not comprehensive statements. To demonstrate professional knowledge and practice, midwives must possess the knowledge, skills, and judgment for safe prescribing and administering controlled drugs and substances. Working within the Midwifery Act and the designated drugs and substance regulation, this includes competency in administering drugs like fentanyl citrate and morphine sulfate, utilizing evidence-based resources for treatment decisions, and committing to continuous learning and self-assessment to improve prescribing and administering practices. To demonstrate person-centered care, midwives must recognize clients as primary decision makers and ensure informed choice in all aspects of care, including when prescribing and administering controlled drugs and substances. This can involve providing detailed information about benefits, risks, and alternatives, ensuring opioid analgesics for labor pain management are administered only with informed and voluntary consent, and respecting clients' rights to accept or refuse treatment. For more detailed information on the professional standards for midwives, please refer to the full document on the college's website. Section 2.2, Record-Keeping Standard for Midwives. The record-keeping standard for midwives outlines the requirements for documentation and record management. It details standards for creating, managing, and retaining records, ensuring they are accurate, legible, and accessible. This includes documenting client identifiers, client encounters, communications, and treatments. It also outlines requirements for the access, management, retention, and disposal of records in compliance with legal standard. To help understand how the standard applies to prescribing and administering the 4 controlled drugs and substances, the following examples are provided. These are intended to be illustrative and are not comprehensive statements. A midwife is responsible for documenting all care they provide to a client, including, but not limited to, recording detailed notes on every aspect of the client's visit, including health status, discussions, assessments, treatments provided, and the rationale behind each decision. Documenting the client's response to treatments and any updates to their care management plans, ensuring all informed choice discussions, including risks, benefits, alternatives, and the client's consent or refusal are thoroughly noted. Keeping accurate records of communications with other healthcare providers and family members. For more detailed information on the record-keeping standard, please refer to the full document on the college's website. Section 3, Opioid Crisis in Canada. This section acknowledges the opioid crisis in Canada and describes the roles that the midwife and the college play in mitigating opioid-related risks of harm. Additional resources for further education are also provided at the end of the module. Section 3.1, Opioid-related deaths and harms in Canada. Opioid-related deaths and other harms continue to be a significant public health issue in Canada. The ongoing crisis is characterized by a surge in opioid-related overdoses and deaths, which is driven by a contaminated illegal drug supply, prescription opioids, an increase in substance use disorder incidents, and opioid tolerance and dependence. According to the Public Health Agency of Canada, the majority of the apparent opioid toxicity deaths have occurred in Ontario, British Columbia, and Alberta. The majority of the deaths involved the use of fentanyl and non-pharmaceutical opioids. A similar trend is seen for accidental opioid-related poisoning hospitalizations, where the majority have occurred in Ontario, British Columbia, and Alberta. Efforts to address the opioid crisis in Ontario require a multifaceted approach and collaboration between healthcare providers, including midwives, public health agencies, and the community. Section 3.2. The role of midwives and the college to mitigate opioid-related harms. In the new designated drugs and substances regulation, the college and the ministry agreed to limit the act of prescribing opioids for the sole purpose of administering. Additionally, the administration of opioids by injection are limited to the hospital setting to minimize risks associated with opioid misuse and abuse. This means that opioids are administered by midwives only for acute pain management in labor and does not include prescribing opioids for client self-administration at a later date or outside the hospital environment. Midwives play an important role in ensuring the safe prescribing and administration of opioids. The federal and provincial legislation and regulations and several standards of practice, including those referenced in this course, provide the necessary framework to support safe opioid prescribing and administration. Midwives are responsible for being familiar with and complying with all applicable laws and standards. The responsibilities include, but are not limited to, only performing controlled acts that they are competent to perform within the midwifery scope of practice, demonstrating professional knowledge and practice, collaborating with other health professionals, being accountable for one's decisions and actions, providing person-centered care, and maintaining accurate records. Midwives must also be aware of and follow hospital policies and procedures and community standards when prescribing and administering opioid analgesics. Section 3.3. Useful links and resources. For more information, please visit the provided links to resources on the opioid crisis, the college's standards of practice, and the Association of Ontario Midwives website, which provide comprehensive resources, including clinical practice guidelines and a pharmacology app. Links to all resources are available at www.cmo.on.ca. Section 4. Completion. Section 4.1. Closing remarks. As we conclude this module, remember that as a regulated health professional, your responsibility goes beyond merely understanding and complying with the legislative and regulatory framework. Midwives must be committed to an ongoing process of learning, self-assessment, evaluation, and identifying ways to best meet client needs. Midwives must also work in accordance with hospital policies and procedures and community standards. All midwives practicing in Ontario must also utilize their knowledge, skills, and judgment relevant to prescribing and administering drugs and substances. Legislation and standards can never foresee or address every issue or ethical dilemma that may arise throughout your professional career. Your decisions and actions must be justifiable. 4.2 Declaration of Completion. Congratulations! You have completed this e-learning module on the safe prescribing and administration of controlled drugs and substances. Registrants are required to declare in the college's registrant portal during the 2024 registration renewal period that they understand and are in compliance with the requirements that must be met in order to prescribe and administer the controlled drugs and substances set out in Schedule 4 of the Designated Drugs and Substances Regulation, made under the Midwifery Act. Links to all resources are available at www.cmo.on.ca.